Hi, I'm Dr. Bliss Lewis. I'm a psychiatrist and an integrative medicine doctor, and let's talk about the use of herbs for mental health. So, herbs and supplements are one area of interest for me, and in this one, we'll cover just herbs, a few different herbs that have evidence or the most evidence from research for treatment of mental health. Herbs are very popular in general use. People have been using herbs for physical health, mental health for thousands of years. Generations before us maybe were more knowledgeable and more connected to using herbs for healing. And in a way, we lost some of that knowledge, and maybe we are reclaiming it to some degree with time and with more interest in supplements and herbs. So overall, during the pandemic, like around 2020, there was a big spike in the use of herbs and supplements, and many people did that for medical reasons, for boosting immunity, but also a lot of people started taking herbs and supplements for stress and anxiety. And in just 2020, Americans spent like over 11 billion on herbal supplements, and that was like a significant increase from prior years. So it's a big market. A lot of people use herbs, and there's limited guidance. There's definitely no like government guidance for using herbs. That like FDA does not regulate herbs, so it's really up to US consumers to figure out like which herbs to buy, what makes sense, what doesn't make sense. So let's talk about it, right? Let's look into what's the data, what do we know? And the top herbs bought are CBD, ashwagandha, turmeric, ginkgo, St. John's wort, valerian, maca, rhodiola. These are some of the top herbs bought in the US, and those are often used for physical health, but also many of them are for mental health, right? So it could be maybe trying to address inflammation, but it's also addressing overall well-being or mental health. Research is not necessarily matching where the money is going. So there's the most research on St. John's wort. There's also research on kava and turmeric, right? So even though most of the money is going towards CBD, we actually don't have as much research on CBD. There's some research that looks promising, but it's not exactly where the money is going. So overall, let's talk about some safety and efficacy questions. So herbs are available over the counter. You can just go to a health food store, you can buy herbs online. And in general, herbs are less likely to cause side effects than medications, right? So in all studies compared to antidepressants, the side effect rates, for example, from St. John's wort are much lower. That doesn't mean that they're completely safe, right? And especially St. John's wort in particular has so many drug-drug interactions. So you really need to pay attention to like what else you're taking because you could have some unusual interactions pop up. And it can also, I have other videos talking about the risk for serotonin syndrome with St. John's wort. So definitely something to think about, right? And some of the other herbs also have some risks and concerns. Also, the herb is often like a mix of the whole plant. And the benefit might be from this interaction of components, things from the flower with things from the root or the leaf or the stem. And we only understand so much about that complexity. We also know that adding certain plants, certain herbs together can be useful. For example, adding black pepper to turmeric will increase the absorption of turmeric. And also, herbs are complex. A single herb like valerian can have many different benefits, right? It can be used for anxiety, it can be used as a muscle relaxant, it can be used for sleep and insomnia. It has GABA activity, it binds to benzodiazepine receptors, right? It has flavonoids, terpenes, it has all kinds of things in it. So, these are much more complex agents than a plain medication that really contains like one agent, one chemical formula. There's a lot more research available now about herbal medicines, and the research is advancing, but still compared to how much information we have about medications, it's not that much, right? So the research is limited, it's young, there are issues with funding for research, many of the research studies are small, right? It's often comparing different formulations of the herb from one study to another study using different strengths, different length of time, different placebo. So it's not so easy, and the research is somewhat messy, not unlike most of the research on complementary and alternative treatments. So what are some of the herbs with the most research evidence? Top of the list is St. John's wort. So even though, I gave you all these warnings that it has a lot of interactions, it's also best studied, and we have a good amount of research evidence, and the evidence shows that it is effective for mild to moderate depression, and in research it comes out pretty much equal to SSRIs. Not the same for severe depression, for mild to moderate. It inhibits serotonin reuptake, also has some effect on other neurotransmitters. The caution is that it has these drug-drug interactions, and also it can cause serotonin syndrome when mixed with antidepressants. So don't mix St. John's wort and antidepressants. Next, let's talk about turmeric. So turmeric also has a good amount of research evidence, and the evidence shows that it's useful. It's effective in reducing both depressive symptoms, anxiety. It's also useful for many other things. And it works in this beautiful root cause way, right? It's anti-inflammatory, it's an antioxidant, it's neuroprotective, right? So it addresses the root causes of what disturbs our minds and disturbs mental health. And when choosing a formulation, make sure you choose the one with black pepper to increase absorption. Another herb with evidence from research is saffron. So it's effective for depressive symptoms. In some research, the research is very limited. It's coming from one area of the world, so maybe we need more studies from other parts of the world. But in the research that is available, it looks good. And it looks pretty much as good as antidepressants. And this one, it works through dopamine and norepinephrine reuptake inhibition. So a little different, it doesn't have the serotonin activity, so it's not as much of a concern when combined with SSRIs. And also from the research studies, it looks like more higher doses for a longer time is better. Another herb with research backing its use is lavender. So lavender is often used for aromatherapy, and it can also be taken as a supplement. And it has research showing that it is helpful for anxiety and for depression. It's hard to know exactly, we don't know exactly how it works. It works likely through serotonin and GABA modulation. And from what we know so far, it's likely best to use as an add-on treatment. We don't have strong enough evidence or enough evidence to use just saffron on its own. There's also some research showing that CBD might be beneficial for anxiety, for sleep, for inflammation. And there's a very large dose range. For some people, 5 or 10 milligrams might be enough. Other people may need 50 milligrams to really feel it. CBD is pretty safe, so it's okay, to take one tablet or gummy and then another one and another one to see if there's an effect. And if there's no effect, there's no effect. But for many people, they feel a difference. So you can do your own research to see if that one is helpful for you. So overall, Herbal medicine is this wonderful option and adds to our toolbox for addressing mental health issues. Herbs in general are affordable and in general pretty safe. They're pretty accessible. It is important if you have a mental health condition to consult with a clinician, and definitely disclose to your mental health provider, anyone who's prescribing any medications, that you want to take a certain herb, right? And make sure that there are no interactions, that it's cleared before you add it, especially with any herbs that have strong interactions like St. John's. So wonderful that you're watching this, that you're open to these integrative approaches. Often it is, a mix of conventional and complementary approaches that is needed to achieve whole well-being and full recovery. So these are these wonderful resources given to us by nature, and let's keep them in mind, and let's not forget that there's more than just medications as options for treatment. And even though plants are more complex, they're also our first medicines. So figuring out, what might be helpful as an augmentation or add-on or something to try for mild symptoms might be like a way for you to take care of yourself and prevent something more serious from developing. Thank you for watching. All my love, and I hope this was helpful. Feel free to share in the comments about your own experiences with using herbs for mental health, any tips and insights that you'd like to share with others.